Hello my dear viewers, welcome to VINAI voice. So today we are going to deal about the scalp, that is part 2 session. Okay. So the nerve supply of the scalp. In the scalp we have mainly two nerve supply. Those are sensory nerve supply and the motor nerve supply. Okay. So this is the diagram representing the sensory nerve supply of the scalp. So there are majorly 8 nerves which are supplying the scalp. The first one, supratrochlear nerve. The second one, supraorbital nerve. The third one, zygomatico-temporal nerve. The fourth one, auriculotemporal nerve. So these are the nerves which lie in front of the auricle. This is the auricle. So these are the nerves which lie in front of the auricle, and all of these are derived from the trigeminal nerve. I repeat, all of these nerves are derived from the trigeminal nerve. Okay. Next, the fifth one is greater auricular. The sixth one is lesser occipital. The seventh one is greater occipital. The eighth one is third occipital. So these nerves will lie behind the auricle. These nerves will lie behind the auricle, and these all are derived from the C2 and C3 cervical nerves. I repeat, these four nerves are derived from the C2 and C3 cervical nerves. I mentioned in the bracket the greater auricular nerve is derived from the C2 and C3. The lesser occipital is derived from the C2. The greater occipital derived from C2. The third occipital derived from C3. So these are the points you should mention in the sensory nerve supply of the scalp. Hope you understand. So the nerve supply of the scalp, in which we are dealing with sensory nerve supply of the scalp, there are 8 sensory nerves. So these are the 8 sensory nerves, 4 in front of the auricle. These nerves 4 are located in front of the auricle. They are derived from the trigeminal nerve, and the 4 behind the auricle. So these are the nerves 4 behind the auricle. They are derived from the second and third cervical nerves. Okay, next. So before going to know about the motor nerve supply, please observe this diagram. So this green color one is the epicranial aponeurosis. Epicranial aponeurosis, which is the third layer of the scalp. So this epicranial aponeurosis is formed by the occipitofrontalis muscle. So these are the occipitofrontalis muscle. It has two bellies, frontal bellies and the occipital bellies, right? These are the frontal bellies, these are the occipital bellies. So there are two nerves supplying the frontal bellies, and there are two nerves which are supplying the occipital bellies. What are the nerves? Temporal branch of facial nerve. Temporal branch of facial nerve will supply the frontal bellies, and posterior auricular branch of facial nerve will supply the occipital bellies. Okay, so the facial nerve will have some branches. In that, the temporal branch is supplying the frontal bellies, and the posterior auricular branch supplying the occipital bellies. So these are the motor nerve supply of the scalp. Okay, the nerve supply of the scalp, motor nerve supply. Front of the ear is temporal branch of facial nerve. It supplies frontal belly of occipitofrontalis muscle. Behind the ear, it is the posterior auricular branch of facial nerve. It supplies occipital belly of occipitofrontalis muscle. So this content you should be written in the motor nerve supply of the scalp. Okay, next, arterial supply. So please pay attention towards the diagram. There are 5 major arteries which are supplying the scalp. So these are the 5 major arteries which are supplying the scalp. It is the auricle. So 3 arteries lie in front of the auricle and the 2 arteries will lie behind the auricle. So the first artery, supratrochlear artery, the second artery, supraorbital artery, and the third artery, superficial temporal artery will lie in front of the auricle. Will lie in front of the auricle. And next, the fourth artery, posterior auricular artery, and the fifth artery, occipital artery will lie behind the auricle. So this diagram you are supposed to draw when you get the arterial supply of the scalp. Okay. Next. So I repeat, the arterial supply of the scalp, on each side of midline it is supplied by 5 arteries. These are the 5 arteries. 3 in front of the auricle. These are the 3 in front of the auricle, and 2 behind the auricle. These are the 2 behind the auricle. Okay. Next, venous drainage of the scalp. The venous drainage of the scalp is done by 5 major veins. Okay, 5 major veins. Those are supratrochlear vein, supraorbital vein, superficial temporal vein, posterior auricular vein, and the occipital vein. Okay, don't bother about that. The names of arteries and veins are same. So just if you learn the arteries names, you can able to write the veins also. So it is a point to remember here. So the venous drainage is done by 5 major veins. Next, clinical correlation. So what is the applied anatomy for the scalp? There are 3 major clinical correlations. First one, surgical layers of the scalp. The second one, black eye. The third one, dangerous area of the scalp. So let's see these 3 correlations. First one, surgical layers of the scalp. One, see, I earlier said that the scalp has 5 layers, but the first 3 layers, that is skin, connective tissue, and aponeurotic layer, these 3 layers combined together known as surgical layers of the scalp or the scalp proper, because these 3 layers are tightly attached. They are firmly adherent to each other and they cannot be separated. Okay? Yes. So there are 3 layers of the scalp. The first one skin, second one connective tissue, and third one aponeurotic layer. They are firmly attached to each other and they cannot be separated. Okay. So hence these are known as the surgical layers of the scalp, or it is also known as scalp proper. Right. Next. So before going to know about the black eye, let's know the mechanism how the black eye will occur. See, skin, subcutaneous tissue, okay, and epicranial aponeurosis. So these are the first 3 layers of the scalp. The subcutaneous tissue is nothing but the connective tissue of the scalp. So these 3 layers are known as scalp proper, or also known as surgical layers of scalp. So this epicranial aponeurosis, which is indicated in green color line, is formed by 2 bellies. Yes, the occipital belly of occipitofrontalis, frontal belly of occipitofrontalis, right? So the thing you should observe here that the occipital belly of occipitofrontalis muscle have an attachment behind. Okay, I repeat, the occipital belly of occipitofrontalis muscle have an attachment here, but the frontal belly of occipitofrontalis muscle, there is no attachment here. So this is the green color one is the aponeurotic layer. What is the layer below the aponeurotic layer? The space. This is the space which is indicated in red arrow mark. This space is known as loose areolar tissue. loose areolar tissue. I earlier said that this loose areolar tissue layer will contain the emissary veins. So when there is a damage to the emissary veins present in this layer, the blood in the connective tissue will flow over the orbicularis oculi muscle. What are these orbicularis oculi muscle? These are the muscles present around the eyes. So when this blood flows over the orbicularis oculi, there will be a blackish discoloration of the skin around the eye, which is known as black eye. Okay? Yes. So this is the mechanism of the black eye. I repeat, the loose areolar tissue will have some emissary veins. So when there is a damage to the emissary veins, the frontal belly of occipito frontalis does not have any attachment. So the blood flow over the orbicularis oculi muscle. So whatever the blood is flown over there, okay, they will form an hematoma. So there will be a blackish discoloration around the eye, which is known as black eye, right? So the black eye, the black discoloration around the eye, blood and fluid can however track forward into eyelids because occipitofrontalis has no bony attachment. This point you should mention in the black eye. Next, this leads to formation of hematoma. Okay. Next, the third one, the last slide, is the dangerous area of the scalp. So why it is known as a dangerous area of the scalp? Because the loose areolar tissue is called the dangerous area of the scalp. Why? Because this is the loose areolar tissue, this one. This dotted appearance layer is known as the loose areolar tissue. This loose areolar tissue is supplied by or it is passed by emissary veins, right? So when there is any damage or any something obsession here, the blood and the pus freely tend to collect in this layer, right? So whatever the blood or the pus collected in the emissary veins, from the emissary veins it will reaches to the dural venous sinuses. In the dural venous sinuses, they will form the thrombus or thrombi. It is known as thrombosis. This process is known as thrombosis. Okay. So, this is the reason. I repeat, the loose areolar tissue will contain emissary veins. So, when there is any blood accumulation, when there is an abscess, when there is a pus accumulation through these emissary veins, the pus will collect or the blood will collect in the dural venous sinuses and leads to formation of thrombi. So, the loose areolar tissue is called dangerous area of the scalp because blood and pus freely tend to collect in this layer. So, the pus transferred to emissary veins, transferred to dural venous sinuses, and it will form the thrombi. Okay. So, this is the important question, important long answer question, the scalp. So hope you understand. So my dear viewers, I would like to request you to please share my video to all your medical friends and please drop a like because I took a lot of effort to make this video, and subscribe my channel, follow me for regular updates. Okay, for every week I will post some videos regarding the anatomy, and please comment your opinion. If there are any suggestions how is the video, please comment your opinion and turn on the bell icon and subscribe my channel for my latest updates. So hope you understand everything. Thank you everyone. Have a great day. This is your Vinay voice. Bye bye. Thank you for watching.